Almost the entire Singapore economy could reopen before the end of June. Restrictions will be relaxed on social interactions only if transmission rates remain low. The decision whether to move to Phase 2 in a staggered roadmap will be made by the middle of the month, 2 weeks after the country reopens on Tuesday. The multi-ministry task force also says the discharge criteria for COVID-19 patients has been revised. All patients assessed to be well on day 21 can be discharged without further tests, despite testing positive. Tan Se-hui joins us live for more on this story. Se-hui, the authorities mentioned the possibility of moving to Phase 2 by mid-June. Tell us more about that.
With Phase 1 happening on June 2nd, the authorities are expecting 75% of the economy to resume operations. And if the community infection rate remains low and stable over the subsequent 2 weeks, the authorities will decide whether or not to proceed with Phase 2 by the middle of June. That means we could see Phase 2 happening even before the end of June. And this is what we can expect in Phase 2. The reopening of retail shops and consumer services, dining in at F&B outlets, but of course subjected to a cap. But there will be a more cautious approach for higher risk settings like venues with large gatherings of people or those in close contact. These include enclosed museums, libraries, theaters, religious functions, bars, pubs, clubs, and discos. That's because there have been instances of cases of transmissions in such settings. There will also be ongoing discussions with businesses and organizations on safeguard measures, as well as the precise timing to resume activities in Phase 2. Now, as for the outbound travel in Phase 2, there's also continuing conversations on reopening borders and establishing travel bubbles with countries. This would mean clear protocols in place, including testing of travelers from one country to another, even ensuring contact tracing of travelers while they are in Singapore. This is to give assurance that travelers are free from virus and essential travel can resume for workers. Now, conversations and discussions with countries are ongoing, and more details will be announced with any particular country when the authorities have reached an agreement.
Broadly speaking, Phase 2 will entail the resumption of a wider range of activities, and we expect almost the entire economy to reopen by the start of Phase 2. And the broad items that we are looking at for resumption of activities in Phase 2 would include, for example, retail shops and consumer services. It would include dining in at F&B outlets, but subject to a cap of up to 5 people. It would include the opening of sports facilities and more public venues, including stadiums and swimming pools. It would include allowing social interactions and family visits, again subject to this group size capped at 5 people.
So why have authorities decided on revising this discharge criteria for patients?
So I think they have assessed some data findings. Now, according to National Center for Infectious Diseases, which released local findings, it showed that COVID-19 patients are no longer infectious after 11 days. And according to recommendations by the World Health Organization, patients can be discharged after 10 days from onset of transmissions and within 3 days without respiratory symptoms or fever. Now, the authorities studied this data closely, and they're actually taking a more cautious approach than international standards by only discharging patients by day 21. And patients are only allowed to go back to work after another 7 days. That means day 28. The authorities also wanted to free up capacity to divert to other testing priorities, such as diagnosing migrant workers and clear patients who immediately recover. The Director of Medical Services at the Health Ministry illustrated this point with the preschool sector. That's where 33,100 tests were done for staff members. 11 out of 12 of those who tested positive have recovered and are now not infectious. That means they can go back to work and will not be at risk to staff or children that they care for. The remaining preschool staff is still waiting for results.
All right, Se-hui, thank you very much for that update. That was Tan Se-hui there.